Morning, everyone. I put together some data yesterday for my biochemistry class, and because I went through the trouble of making some graphs, I figure I might as well put them online as well. And we're also near some decision points. So you've probably heard some states are relaxing their requirements. Well, as someone who believes that the data should drive these decisions, what does the data say about these states relaxing their requirements? Spoiler alert, I think they're the wrong states to relax right now. But I have lots of things to say about this. I'm going to try to say them quickly so that you can just scan through and I don't waste too much of your time. And before I get to that, things I heard on the internet that might actually be true. These are things that I just saw the tweet for and I need to look into them more, but they come from someone I trust and they appear to have something that I want to look into. There's a Chinese study that shows that outdoor spread of COVID-19 is very rare. That makes sense to me. I want to look into that more. If that's true, then we don't need to worry as much being outside. New York City serology has come in, 20%. That's actually on the upper end of what I was hoping serology for a hotspot would be. That's good news. Non-hotspot serology comes out for California, and they say that they might have 2 to 4%. I don't believe their error bars, and I think their error bars might actually extend all the way down to 0. And so with that in case, I'm going to say that it shows 0 to 4% of people with antibodies. I would prefer to see more, but still, if the error bars are okay, we won't know until we've collected more data and we've analyzed them right. I have big questions about that study, but the New York City study, I haven't even been able to see questions about it yet. But we are getting more and more of these studies, and let's get more of them. Let's not rest our conclusions on any one individual study or group. Let's get these from across and realize that different locations are going to have different results. In fact, that's why I want to show you this data right here. The data that I'm seeing right now, look, there's differences in severity for COVID-19 across the nation. And if you want a sort of mnemonic that will very roughly show you about the cases of severity, the severity of the epidemic right now in different cases, start in New York City. That's where it's worst. And then go around the country roughly from east to west, from the northeast and curving around to end up at the other end of the country at Washington State, because I think the data shows that Washington State is going very well, especially considering the fact that we still don't have the kind of testing that as a scientist I want to have. But I'm going to make do with the testing that we have, and the testing actually looks really good for us. So let me be very clear that this is all going to be playing out locally. The virus spreading in Seattle is the same virus as what's spreading in New York City, but there are many different factors that make it spread differently. And so when I look at the drop-off plots that I like to look at, the case change, and we're looking at cases on a drop-off plot, let me rank the top 10 list of states that I've looked at from worst to looking better. Worst is definitely the Northeast, but we actually see some glimmer of good news in New York. The Southeast is second worst. The central part of the U.S., and I realize I'm lumping a lot of states together here, and I'm only looking at a subset, but they're sort of third. They're not that worrisome, but they're still not, I'm not ready to say they're in the clear. Of all the states, it looks like Washington and Louisiana are doing the best. So, when you look at this ranking, this is what the data says how the states are doing. Which ones, the ones at the bottom of the list should be able to relax. So which ones are relaxing? Ones in the middle, or even ones at the top, the ones that I would not relax, but I'm not in charge, right? I'm just the scientist who's advising, and then they can basically blame me if I get it wrong, but if I get it right, then they can take the credit for it, whatever. Georgia, Florida, Texas, Colorado, they're in various ways, they are relaxing a little bit. So what I'm going to say is that politics and science are two different things, and anyone who says I am doing my politics according to science, that can be kind of true, but it's never entirely true. You're always mixing in your politics with science. So I'm going to bring in the science, and I'm going to say, apply your politics to this, okay? At least let's start with this foundation. These are the reported cases with all the ups and downs of what that could be. And so here's the drop-off plot again. I've done different colors, and the thing I want to draw your attention to, lots of colors here. The gray and dark gray dots that you see on the top are the New York and New Jersey hotspot, which I believe should be looked at together. And you see that New York is way up there on this plot. New Jersey is the darkest square that you see there, and that is basically going flat, even going up a little bit as far as new cases discovered. The one thing that I can bring out from this is that New York has hit a wall. You see that curve down. We're looking for that to drop off for cases. That means that we are past the peak and we're running up against the infection actually slowing down. Down means slowing down. And that's what we see for New York, finally. I don't believe that this is capacity in testing because we've tested a lot in New York. I'm hoping this is capacity in what the virus can do to us and that we're running up against the wall of that in New York. So if that's what's happening in New York, you can look up and down, you can see there's a couple of lines that are dropping off. Even in this respect, you can see that the green line is dropping off and the purple line is dropping off. And what are those two? So we have to zoom in from the northeast hotspot to exclude that to look at the other hotspots. Otherwise, they're all on top of each other. So here's a zoomed in plot. And you can see right here, it's still kind of a jumble, but you can see that the green squares and the purple circles stand out. Green squares are Washington State, purple circles are Louisiana. You can see also there's a little bit of a drop-off in Michigan. That's all right. But it's not nearly to the same extent that we see for Seattle, Washington State, and Louisiana. So let's zoom in a little bit. This is still too much to look at. So let's zoom in a little bit. Let's look at West Coast, because my contention is that the West Coast is doing better than the rest of the country when it comes to this. And you can see that, yes, it's bouncing down. I even had to cut off Oregon because Oregon is so low on this graph that you can't even see. It's kind of flattish, but it's so low. I'm just going to say that they're looking good to me. California is bouncing around and actually going up. So this is kind of concerning, but also California has totally messed up their test reporting. They've had backlogs and then they've put them out. What we see here, we can't know really what's going on. The good news for California is they are not spiking in deaths. I'm not going to show you deaths today because this is complicated enough. And this also is, the cases are the fastest responding to what we're doing. And since we're talking about fast decisions, let's talk about cases. So you can see here, California is weird. They're not doing a good job with data reporting, but they appear to be a good job in avoiding a hospital surge and taking care of people the best they can. So I'm going to lump them together with Washington and Oregon as, boy, it looks like it's going okay. Let me add in Seahawks colors because I miss the Seahawks and hope they draft well today, if they draft at all. The Washington King County Snohomish line that I added in there. You'll notice that that's sort of bouncing around, but it's definitely dropping. And on the scale of all the other states that you see here, it's definitely on the high end of the states that are dropping. If there is evidence for stuff dropping in one area, the evidence is best for the entire country that it's dropping right where I'm at. And this is good because I've had lots of worried podcasts for a long time. This data comforts me. By the way, also, you'll notice that the data isn't entirely going down for Washington. It's bouncing around. Again, there were some shenanigans. I don't want to say shenanigans. That sounds deliberate. But there are some weirdnesses with how the data was collected and reported earlier this week. Regardless, if when you look at it from this perspective, stepping back and looking at it sort of at a week-by-week basis, you definitely see that there's a big drop-off. Whatever's going on with the bouncing around of the data, it's not what's going on in California, and we look the best in the nation, even with that weird bounce that comes from, again, reporting and collating data. So why I tell my students, reporting and collating data, it's really important that you do it right and you do it the same way. When you don't do it right and don't do it the same way, and coordinating state agencies and stuff like that, then you get data that's hard to interpret. So I think we have a little bit of the state agencies not figuring out. I mean, they've got a new situation to deal with. I understand. We just got to interpret this data not too closely, but we can still interpret it. And it's looking good in Washington State. So let's look at the central part of the country. Here we have Colorado, Michigan, and Texas that I've made big. Colorado is flat, and that's looking okay, but it's not dropping yet. What I find interesting is Colorado is relaxing restrictions on people already. Okay, well, we'll see how that goes. I would prefer that we have the ones who are dropping relaxing restrictions, but we can see what happens, and I'm going to put this online right now. Here is the proof. I don't know what's going to happen in the future. We'll chart this graph as we go forward and into another week or so. Texas, also flat. Michigan, flat-ish, but going down. Again, these were states that I was worried about earlier, especially Michigan. It looked like they had a hot spot in Detroit. It looks like it's under control and even dropping. Candidate for relaxing if you want to follow the science. If you want to wait a little longer until it drops as much as Washington and Louisiana, okay, go ahead. That's your choice as a state. But realize you're doing better. And things are looking okay so far. So let's move around to the Southeastern Conference states. This is where I went to college, by the way. I went to Florida, so I made the orange and blue markers for Florida. You can see that Florida is actually going down a little bit. And so here we are. If they're making some relaxations, we'll see what the effect of those relaxations are on the data once we have another week to see those come through. The problem is this thing has inertia. This thing has momentum. And once another week happens, we might start to get on a growth curve that we can't handle. But when I say we, I really mean they. You know, it's not my decision, and I'm just going to plot the data, and I'm going to say they're making this decision. And so I'm going to use the data, since it's public, to rate how the decision is going. Georgia also is bouncing around, and in fact, Georgia, you might have heard, is the one who is relaxing the most restrictions. And on this plot, it's flattish but going up. You know, that's looking like New Jersey right now. It's just on a different scale. And so I would not pick Georgia. I would put Georgia at the bottom of my list of places I would open based on the dynamics of the disease alone. There might be other factors that mitigate these choices. We don't know. And so stop making predictions about how everyone's going to die in Georgia. But I'm worried about Georgia because I don't want anyone to die in Georgia. But if they make this decision, let's chart it with the data. And let's also try to make sure that testing is consistent. That's the other thing. These are cases. They depend on testing. If testing is not consistent, then you'll get a flat curve even if the disease is going up. We can't wait for deaths, though. At this point, deaths take 18 days, you know. That is too long of a lag. So we're going to use these with the realization that no data is perfect, and these data are more imperfect than others in some cases. The other thing I'll see, while I'm talking about Georgia and Florida being mildly worried for them, Louisiana impresses me because they were the second hotspot after New York City, and yet they did turn around, and they were able to bring this down. I actually think Louisiana, it was scary enough, and it went up high enough that maybe we should wait a little more. But we're getting to the point where Louisiana looks like Washington State. Okay, let's keep an eye on that. And Louisiana does not have the weird bounce that Washington State has, but again, I think that's a data effect. I don't know. I don't know until we see it. So I want to try to make data-driven decisions. Everyone wants to try to make data-driven decisions. But I'm going to say right here as a scientist, no decision is entirely data-driven. You are always interpreting the science. And so when you say, I'm going to follow the science, great. That means you're going to prioritize the science, but you still have some non-scientific priors that are going to influence your decisions. Be honest about that. And I'm speaking to all politicians when they're saying this. Science is not neutral to the assumptions that you bring to it. And if you assume that these, X, Y, and Z is what I'm really afraid of, then you're going to see that in the science. So what I'm doing with these updates, I'm going to give you the science, and now I'm going to move into a little bit of interpretation. So this is where you can turn me off if you want. Again, the good surprises, Washington and Louisiana are looking good on a drop-off plot. The other ones are looking kind of okay. New York's even looking better, but you can see how much worse New York is. The good news in that, the entire country is not New York. There might be some factor, and it might just be stochastic or random chance that New York got the worst end of it than other things. I don't know why San Francisco was spared and New York was hit really hard. I can't find out yet exactly why that is. So, and I don't feel like we know yet, and I think it's kind of irresponsible at some point to guess about it too early. But there are different factors, and how much do these matter? This is my guess of what the order of importance is. Age demographic. This is why Italy was hit especially hard. Younger places, how much does that protect them? I don't know until we look, but I think it does help. Urban density seems to have a big effect on this. So rural areas relaxing, maybe they can do that. How early you put the restrictions on, that's great. But I'm not sure that it has as huge of an effect as we've been told. Again, let's look at the data and let's see the kind of restrictions. And let's remember one thing. Restrictions are always a spectrum spread out over time. And they're what people choose to do as well as what people are told to do. Don't just take the date people were told to do and say, okay, I can figure out everything else from there. The 1918 paper that I showed earlier actually had a long discussion about how do we say this one date is when the restrictions started. And because they weren't able to get all that data for Seattle, they didn't include Seattle in their analysis for the 1918 paper. We've got to be the same way. We've got to realize that restrictions are voluntary and imposed, and they're complex and they're phased in. So we can't just say, oh, this date was when the restrictions were, and then the disease did this. It takes more interpretation. Science rests on assumptions that you bring to it. Another thing, and this is scattered and messier, but I really do think that there's some possibility in the data that temperature and humidity might have an effect. That's good news for us as we move into summer. It's sort of bad news as we look ahead into fall, but at least that's a couple months away, and who knows what we can learn, good surprises that we can develop as we brace for bad surprises in the fall. For my Christian friends and my my Jewish friends as well who might be reading this, or anybody who's interested in how the scriptures have to speak to this, there's the 2 Kings 7 has a story about this. And I want to say that this is a story, you can read it yourself. This is a story that I'm hoping happens in some way, because I'm saying that the wrong states are relaxing. Well, we have a story there where the wrong people, because they weren't allowed into the city, left and actually went over to the other army in what looked like a traitorous move. They found out that the army was already defeated, very dramatically. We can't count on the army being defeated dramatically, okay? But we can say that the wrong people, the people that we wouldn't pick, can sometimes give us good information about the way things are going. In my optimistic times, I hope something like this can happen with the wrong states. Maybe they can find out that there are some factors that protect them. Probably they'll find out there's a mix of factors. It'll be complex, and then everyone will be able to tweet about it the way that they already decided they want to tweet about it from the beginning. But at least we can start to say, okay, what looks like it was the most important factor here out of this mix of factors? We'll still be uncertain, but we'll be a little less uncertain about some things. So I'm hoping it goes well for people. I don't hope that it goes badly for people just so I can make a point. Looking at the data, I would say here in Washington State, let's relax. Let's say specifically where we can start to relax. We have to take little steps when we do this. It's like as a country we've gotten a really bad stomach flu, and we've got to take little bites when we're feeling better, take little bites to see if it all comes back up again, okay? Forgive the crudeness of the metaphor, but that's really kind of what it feels like right now. I know it feels like you'll never eat again sometimes, and you're not even really hungry necessarily. But I think there are proper, smaller risk, little steps that you can take that can help people experience some of the good things that might be out there. At the same time, there's some scary stuff coming in about how the virus is operating and the kind of blood clots that it can cause. It's clear that we don't know entirely all the bad stuff that this virus has in store for us. So there's still an army at the gates from what I can tell. But if somebody goes out there and says there's not an army at the gates, that this sector or this kind of effect is protective of a group of people, great. Let's rejoice, you know? But let's also make sure that we know that that's real, and that's where the science and the data come in. So that's the data. Interpret it as you will. I will check back in with the data in another week, and we'll see where it leads us at that point. Until then, take care of yourself, and remember that you don't have to accomplish much. Just being alive is an accomplishment some days, and that's okay if that's the case. All right.